Good morning and a very warm welcome to everybody who is joining us today. My name is Carolyn Gillespie. I use she, her pronouns, and I'm the Director of Services at Thorne Harbour Health. I really am delighted to welcome you all here today to launch our report and our practice guide to the responsive pandemic practice, LGBTIQ plus family violence service innovation in Victoria during COVID-19. Firstly, and most importantly this morning, I want to acknowledge the traditional custodians of the land that I'm joining from, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders, past and present. And I would also like to extend that acknowledgement to the traditional owners of all Aboriginal country that people are joining from today. I know that there are people joining from right across Victoria and perhaps interstate, so it's important to acknowledge all owners of all country. And I also wish to acknowledge any Aboriginal and Torres Strait Islander people here today, and thank you warmly for joining us in this launch. We had over 100 registrations for this forum, and we have 75 participants so far who've joined us today, which is great to see. I would also like to welcome our Auslan interpreter, Donna, who is here to interpret the proceedings for us. So today we, Thorne Harbour Health, and our partner organisation, ARCSHS, at Latrobe University and Switchboard Victoria, are proud to be launching this research report. And I would like to warmly welcome our two distinguished guests and speakers to today's event. We have Eleri Butler, who is the CEO of Family Safety Victoria, and Todd Fernando, the Commissioner for LGBTIQ plus communities for the Victorian Government. Thorne Harbour Health has a long history of responding to community need in times of crisis. Our organisation was born out of another pandemic, the HIV and AIDS crisis of the 1980s. And Thorne Harbour Health is an LGBTIQ community-controlled organisation that provides services for people living with HIV, as well as our diverse and wonderful LGBTIQ plus communities. Our head office operates from Hoddle Street in Abbotsford, but many of our programs and services are statewide, including all of our family violence work. We also operate from the wonderful and new Victorian Pride Centre in St Kilda, the Positive Living Centre in Paran, Thorne Harbour Country in Bendigo, and we have services in health promotion and alcohol and other drugs in South Australia. Thorne Harbour Health, along with our partner organisations in this work, want to thank Family Safety Victoria very much for funding and being committed to the development of LGBTI community-controlled and led research and practice development, research and understandings of our own communities delivered and designed for our communities by our communities. This important research has been undertaken by the Australian Research Centre for Sex, Health and Society at La Trobe University, and it highlights the experiences of the LGBTIQ plus community in Victoria during COVID-19. The report has identified how LGBTIQ plus community members have been disproportionately affected by the pandemic and highlights barriers to services experienced by people seeking support. The report also highlights the resilience of communities and the innovations that grew from such a challenging time. When intimate partner and family violence is understood only as men's violence against women and children, the experiences of LGBTIQ plus people and their relationships are made invisible. Our long-term work with this community and our community members who are victim survivors or people who use violence and their friends and families, as well as research into this, bears this out. This lack of recognition of the level and types of violence experienced by LGBTIQ plus people and communities often makes it difficult for people to acknowledge the violence in their relationships or to even see their own experiences as violence. The practice guide, which has been developed to inform clinical practice going forward, outlines the lessons learned from service delivery by Thorne Harbour Health and Switchboard Victoria during the lockdowns over 2020 and 2021, and highlights the benefits and opportunities of a hybrid service delivery into the future. Family violence services that are flexibly designed, client-centred and accessible for all members of our community are at the heart of our work, and I'm very proud of what we deliver to and with our communities every day. This is being recorded today and will be available after the session with live captioning for those who wish to have a copy of the recording. I now hand formally to Eleri Butler, the CEO of Family Safety Victoria, who will officially launch the report and practice guide. And my many thanks and gratitude to you, Eleri.
Thank you so much. It's great to be here. I'd like to also start by acknowledging the traditional owners of the lands on which we're all meeting today and acknowledge their people, culture and heritage. I'm on the land of the Bunurong people and pay my respects to their elders past and present. It always was, always will be Aboriginal land. Sovereignty was never ceded. I'd also like to extend that respect and acknowledgement to Aboriginal people and colleagues who may be here today. And also I want to acknowledge all victim survivors who may be here today too, whilst we also remember those who've been tragically killed as a result of family violence. It's really vital we keep forefront in our minds all who are experiencing family violence and sexual violence today and every day, and it's for whom we undertake this work. Well, I'm really thrilled to be with you today for the launch of the research report, Responsive Pandemic Practice, LGBTIQ plus Family Violence Service Innovation in Victoria during COVID-19, and what innovations we've seen. I can't wait to hear the project team discuss their research and insights. I'm not going to go into any detail. I'm just going to say a few introductory comments. I'm also delighted we're hearing from LGBTIQ plus Commissioner Todd Fernando today, who I've heard speak many times, always deeply inspiring and very powerful words. So I'm looking forward to the session today. And I'm pleased to be launching the report and being at the session today, because this is a really valuable and Australian first report that focuses on how LGBTIQ family violence services underwent a major and rapid transformation in response to COVID-19. It really highlights sector innovations and challenges assumptions as well about how family violence services should be delivered, which is really, really important. And as many here today will know, that the family violence reforms in Victoria aim to improve inclusion, accessibility, responsiveness and safety across services for all Victorians, particularly and including LGBTIQ people. And we've also invested in tailored initiatives for LGBTIQ people, including funding LGBTIQ plus specialist services led by and for community members, supporting all specialist family violence and sexual assault services through programs like the How To program and other programs in relation to improving accessibility and response, like the Rainbow Tick accreditation, for example. And we've also invested in the LGBTIQ plus family violence capacity building project. So there's a few initiatives underway, but it's really important, I think, to reflect on what the COVID-19 pandemic, not to say that we're out of it, but what that's meant for our service delivery and innovations, and what this means for future delivery and practice, because we know the associated lockdowns had at the time and continue to some extent to have a profound impact on experiences of family violence and sexual violence, and how victim survivors access services, and also what we do in relation to interventions with people who use violence. And that's one of the reasons why the Victorian government committed to targeting some research projects, particularly in the Family Violence Rolling Action Plan, to contribute to the family violence and sexual violence evidence base within the context of the COVID-19 pandemic. And as part of that rolling action plan, Family Safety Victoria, which is where I'm from, commissioned research, and particularly projects on how COVID-19 has impacted the prevalence and patterns of and experiences of family violence, and also how the pandemic has rapidly transformed the ways government and services respond to family violence and sexual violence. The research was designed to test ways of collaboration and multidisciplinary practice between researchers and service deliverer organisations through those partnerships, as well as improve information sharing and capability building between academics and universities and the family violence sector, specialist services, targeted services and government. And that model really leverages the wealth of knowledge and expertise and experience we've got across the state in relation to responding to family violence and sexual violence. And the findings will very much inform our reforms and the policy that we're developing through the next stage and the next few years at government level, and we're very much working collaboratively with communities in that regard. It's also the findings of this research is really important because it's going to help shape future partnerships between government and service deliverers and the research sector and the family violence sector, and will provide that really meaningful and practical insight into what needs to change and what needs to happen on the ground, what works on the ground. These projects used multiple forms of data collection to help tell the story of services and also of service users, particularly, including capturing the stories from people that may have been unable to participate in research interviews. And it also heard from people that experienced multiple and intersecting forms of inequality and disadvantage. So today's report, which we're going to be talking about in a bit more detail from other speakers, it was led, as you said, by Latrobe University's Australian Research Centre in partnership with Thorne Harbour and Switchboard Victoria, which is a fantastic partnership to be able to invest in. It investigated service changes and innovations, as has been flagged for family violence for the LGBTIQ plus community during the pandemic. And whilst the sector is well versed in responding to a very diverse range of needs and circumstances, COVID-19 was really, really testing for all of us. And one of the things it did was challenge the primacy of delivery of in-person support services. It changed the way our connections, our work, our businesses and communities operated. Many were paused or stopped or moved to an online presence, and so too was the delivery of family violence services challenged in that way. So it's really important for us to have this analysis and investigation and research into what needs to change and what's worked and what's what adaptations worked well and what may need to continue into the future. It meant for many people that many people were dealing with multiple challenges on all fronts. We know whether that was employment insecurity or job loss, financial strain, isolation, loss of support networks, fatigue broadly. And this all adds to the burden of responding to and also experiencing particularly family violence and sexual violence. Services we know were stretched. We know that restrictions impacted on how LGBTIQ people across the state accessed services in Victoria. And we also know that those services that had to find flexible and innovative ways of working to meet the needs of community members. So that's what I'm really excited about to learn from in relation to this research, is how those adaptations within the sector helped keep people at the centre of everything they do, people experiencing family violence at the centre of all of our work, especially during the challenges we faced and will no doubt continue to face as we move into the future. I know that the findings that we'll hear about today are of really critical importance to the family violence sector as a whole and deliver important insights into, as I said, the impact of COVID-19 and associated service responses. It's vital because it's going to help support government decision making in the future in response to the pandemic and ongoing responses in relation to family violence and sexual violence reforms. We're still a lot more to do in this space. So I'm really confident that by sharing these innovations and flexible practices, we can scale up and strengthen our responses in future crises, and understanding how services respond and adapt to increased demand and complexity of presentations and experiences, and how they continue to deliver outcomes for LGBTIQ plus people during COVID and beyond is really important for us to plan a pathway to ongoing recovery for survivors, and also to plan more sustainable investment into the future. So I want to hear from other people. I'll stop there. Thank you very, very much for inviting me to the launch. I look forward to hearing from our fantastic speakers and panel members, and to hearing from questions from attendees. And at Family Safety Victoria, we remain really committed to supporting LGBTIQ plus led services for the benefit of LGBTQ plus communities across the state. So really appreciate being here and looking forward to hearing the rest of the conversation. Thank you, and back to you.
Thank you so much, Eleri, for that wonderful launch of the report. I will now hand over to Shane Worrell, the Research Officer at the Australian Research Centre for Sex, Health and Society at Latrobe University. Shane was the research lead on this project, and he will present to us the findings from the research.
Thanks very much, Carolyn. It's really nice to be here, and thanks for everyone for joining us. It's great to see so many people here. I'm just going to start by sharing my screen and pressing start there. I'd also like to start by acknowledging the traditional owners of the land from which I'm speaking. That's the Dja Dja Wurrung people of the Kulin Nation. I pay my respects to elders past, present and emerging, and I recognise that sovereignty was never ceded. So hello everyone, my name is Dr. Shane Worrell. I'm a researcher at ARCSHS at Latrobe University. I had the privilege of being the lead author of this report. I'm here to give you a brief overview of the study before handing over to others. And we'll start by saying that the report provides a snapshot of life during COVID-19 for LGBTIQ+ people accessing family violence services and professionals providing support. Before looking at some of the findings from the report, let's consider some of the context. As we know, family violence has devastating impacts on individuals, families, and communities. Research shows that LGBTIQ+ people experience family violence at levels similar to the general population. They experience violence that's physical, sexual, and psychological in nature, as well as abuse that can be specific to LGBTIQ+ communities, such as outing, withholding of gender-affirming therapies, and threats to disclose one's HIV status. The COVID-19 pandemic and all the restrictions that came with it reshaped not just the experience of family violence and the harms that people were exposed to, but it also required a dramatic and almost immediate transformation of how we deliver family violence services. So our new report, Responsive Pandemic Practice, explores how Thorne Harbour Health and Switchboard Victoria innovated family violence services during COVID-19. So at the heart of what we've done really is taken a breath and stepped back to reflect on everything that happened during the past 2 years, which we know were just really intense for everyone. So everything happened really quickly and out of necessity, and people scrambled to make things work. And I'm sure that's a very familiar scenario to you as well. But there was an opportunity to document some of this and learn more about the responsive practices that have been effective. So we interviewed 38 people, and that was 19 family violence sector staff. 14 of those were from Thorne Harbour and 5 from Switchboard. There were 15 victim survivors and 4 participants of Revisioning, which is a men's behaviour change program at Thorne Harbour. So the focus of the report really is 2 things: Thorne Harbour's pivot to a flexible service model in March 2020, and also Switchboard's launch of Rainbow Door, a specialist helpline that provides support for family violence and other issues. And that was in September 2020 during that really long lockdown. So turning now to some of the findings, both organisations were created by LGBTIQ+ communities to support their members during a time of significant adversity, and that was the global HIV/AIDS crisis. So it was really interesting to us to observe how that organisational memory was important to both organisations and their response to COVID-19. So they drew on these histories of supporting communities through a pandemic, and it has to be said, in many ways effectively. It allowed them to respond quickly and ethically in a way that centred the needs and the safety of community members. There was also a strong level of community spirit within individual professionals. Many staff interviewed identified as LGBTIQ+, and their passion for the work they were doing was something that really came across strongly in the interviews. So while employed as professionals, they were bringing a peer experience to their roles as well. And one of them said, you can see on the screen there, about service delivery continuing despite the pandemic, that it was personal for our staff and our organisation that we continue to do this for our communities. And that was very much a theme in the interviews. So let's look at some of what the response looked like. Firstly, at Thorne Harbour, it was rapid. So steps taken early in the pandemic transformed how services were delivered. Staff were working from home and services and programs were shifted online. So at the heart of the changes was the integration of more technology into family violence service practice. So as was the case for many other organisations, Zoom became central to the way programs and services were delivered. Before COVID-19, technology like Zoom was not widely used to provide support to LGBTIQ plus people in family violence situations, if used at all. And a shift to telehealth, particularly counselling, was necessary in terms of service continuity. But to get there, there was lots of ethical challenges that had to be worked through. So this included challenging expectations that behaviour change programs must have an in-person component to them to ensure accountability. And lockdowns meant that some victim survivors, for example, were at home with people who had used violence before. Although Zoom was widely used, it was safer for some clients to receive a text, for example, while they were in the bathroom, or a phone call while they were out walking during the period of time during a lockdown that they were able to go out. And this was really delivered on an individual basis for the client. So lockdowns made it difficult for victim survivors to access support. There were tech issues for some clients, but many participants felt that Zoom counselling was a mostly effective alternative to in-person counselling, given the circumstances, and that in-person counselling was impossible during those lockdowns. So some clients felt that video calls could not replicate a counselling room and a counselling experience in ways that allowed full emotional expression, but many considered them effective enough in meeting their core needs and providing that continuity. Among those who had more or better access as a result of telehealth were people with disabilities, those living in rural or regional Victoria. So we saw Thorne Harbour acting as a statewide service even more than they previously had, and clients with concerns about leaving home, and this could be for various reasons. Experiences of flexible service varied, but most clients interviewed found them largely effective once they were accessed, and I'll talk about that access more in a minute. With some exceptions, participants spoke positively of Thorne Harbour's efforts to implement telehealth given the challenges faced. So a significant barrier to client needs being met were waiting lists for Thorne Harbour services, which grew longer during 2020, 2021. Waiting periods tended to last from a few weeks to several months. After experiencing violence, many clients were in severe need of support. But waiting weeks or months for counselling was extremely difficult. And as a client on a waiting list said, and I found this quite moving, this statement. I was crumbling, literally trying to get to work, trying to keep my head above water. The wait time for me was the biggest thing. And I think that was the most dangerous period for me, and probably the time I needed support. They weren't really aware that I was at harm, self-harm that is. It was really disappointing and quite traumatizing. I was really in a dark pit. So staff members felt stretched by the demands of providing services from home, holding clients as these waiting lists grew and the uncertainty of the pandemic loomed large. And they too were frustrated by the waiting lists, with one saying the wait time for family violence can be up to about 3 months. And I think the concern is that anything can happen in 3 months. Staff were dealing with their own challenges, of course, and sought unsuccessfully at times to keep a divide between home and work. And I think this is a challenge that we can all understand to some extent. Turning to Switchboard now, they launched Rainbow Door during a long lockdown in September 2020. It's a specialist helpline that provides information, support and referrals to LGBTIQ plus people experiencing a range of issues. Callers can identify themselves, which is part of the process in working with them to direct them to the right support. Central to Rainbow Door's work is supporting LGBTIQ people experiencing family violence. And when it opened, the service was inundated with calls. A quote in one of the reports was that the phone started ringing and it didn't stop. And I think this came as some surprise, but it also just demonstrated what had been tapped into. This was a vital service that was suddenly being offered at a crucial moment. Staff talked about taking calls from community members with family violence, suicidality, mental health access, depression, anxiety, and isolation issues. And demand was continuing for the 15 months up until we conducted the interviews. So again, it struck a chord, and it shows just what a vital pathway option it became. But what was meant to be a real-time helpline often operated as a callback service due to the demand. And staff also had to hold clients who were on waiting lists at other services. Again, staff were working from home, experiencing a range of their own challenges, exacerbated client situations, and yeah, okay. Okay, as I said at the top, we had the privilege of being able to hear from people who've been under intense pressure over the past couple of years and to share some of their views. What I've given you is very much an overview. The report goes into things in much more detail, but I'd like to say that we know how much everyone struggled through the pandemic and associated restrictions, but the intensity of some of those situations for clients and practitioners were particularly striking and unrelenting, it seemed, for that whole 2 years period. So a number of participants actually commented that the interview with us was actually the first time they'd been able to stop and reflect on the events of the past 2 years because of the demands they'd faced and the pressure they'd been under. So others said they didn't expect the impact of the past 2 years to really be fully understood for a long time to come. So our research scratches the surface of these experiences. I don't think either organisation would claim their response to COVID-19 was perfect, and I don't think it could have been under the circumstances, but it was very effective under the circumstances and has the ability to positively shape future practice. There's a few things worth thinking about immediately, is that video counselling and telehealth are now an important part of flexible family violence services. And I think remote work also has a newly defined place as well. Participants some of them were still uneasy about counselling taking place over something like Zoom, suggesting that more secure platforms are needed. And other lessons emerging from the past 2 years really reinforce the need for flexible, responsive services that cater for a range of factors such as disability, location, cultural background, visa status, neurodiversity, and we could go on. So it's not just technology that's important here, it's also organisations' ability to be flexible with that technology to ensure individual client needs are foregrounded. Neither Thorne Harbour nor Switchboard Rainbow Door have been resourced enough to employ the staff that they needed to address the demand. So hence the waiting lists have grown longer. And also, important point, that suitably qualified staff equipped to meet the demands of LGBTIQ+ family violence service delivery are difficult to find and retain. So beyond COVID, organisations need to continue being responsive to individual client needs and building capacity, strengthening referral pathways, retaining staff, and scaling up services are some of the things that will help, especially as the sector faces more challenges, including emerging and potential health emergencies. So that really concludes my overview. This has been wonderful research to be involved in, difficult for sure, but vitally important stories that need to be told. Before handing back to the panel, I'd just like to acknowledge the support of Family Safety Victoria, whose funding made this project possible. Trish Mitrakan, Mary Lee, and Cosima McRae were all a pleasure to work with and hugely supportive of the research. I want to thank Todd Fernando for being here today, as well as Eleri, but also ongoing support from the Commissioner for the research is just fantastic. It's really been a partnership effort, and it was both enjoyable and productive to work alongside colleagues at Thorne Harbour and Switchboard Victoria. I want to quickly acknowledge the authors for their significant contributions: Jackson Fairchild, Stephanie Lusby, Caroline Gillespie, Alicia Fuchs, Libby Jamison, Marina Carmen, and the lead investigator on the project, Adam Bourne. I'd also like to thank Jessica Hunter at Thorne Harbour. But most of all, I'd really like to give thanks to the participants interviewed for so generously sharing their experiences with us. It's an honour to have been able to speak with you and to reflect some of your experiences in this research. Thanks very much for listening. I'll hand it back.
Wonderful, Shane. Thank you so much for that overview for the work. I would now like to invite Todd Fernando, our Commissioner for LGBTIQ+ communities, to say a few words.
Thank you so much, Carolyn. For those of you I've yet to meet, my name is Todd Fernando. I'm a queer, cisgender, Wiradjuri man. I use the pronouns he, him, and I have the pleasure of being the Victorian Commissioner for LGBTIQ+ communities. I'm a descendant of the Kalari peoples of the Wiradjuri Nation, which means I grew up in what is now known as central New South Wales in a country town called Condobolin. And I often make the joke that Condobolin is a town that also where Shannon Knoll comes from, and so 60,000 years of history comes down to Shannon Knoll. But we're hopefully changing that work as well. But I want to acknowledge the lands and the ancestors of the lands that I'm on today, and pay my respects to their ancestors, past, present, and those who are emerging. And I want to pay my respects and do a big shout out and thanks to people like Carolyn Gillespie, Eleri Butler, Simon Ruth, Joe Ball, Adam Bourne, who as leaders within our communities continue to hold space for all the ways that our communities need to think about the work, this work in a multitude of ways. And of course, the authors of this report, Shane Worrell et al. It is brilliant, and I express my deep gratitude for your commitment to seeing this through. It will be felt for generations. This report is broad, impactful, and very enduring. The work that we're doing here in Victoria, both in family violence and within LGBTIQ+ communities, and how the approaches we're taking to intersectionality and working with lived experience, I think will set a new course for how we think about men's behavioural change programs and the work in the sector as a whole, and how that intersects with the way with the way that services adapt and continue to do the work that we need to do with perpetrators of family violence or those who choose to use violence within our communities. So this report speaks also to the need to innovate in this work and the importance of healing from shame, which is something that I spoke not too recently about at the No to Violence conference. I want to acknowledge the other people in this room, particularly those who've been leading this work for many decades. And there are people here who've been practitioners for a very long time trying to deal with this space. And I can only imagine then when the work of governments and other organisations who have seen this work change in such ways, and if we're being honest, in such short space of time, we know that it's different for how it was done years ago, and the resourcing itself is then different from that as well. I want to pay tribute to the unique challenges also in taking your work online during the pandemic. This report shows us how you've been able to do partner safety and partner contact work, particularly when you might have partners or other family members in the same household who might be off screen. And I know and I've heard stories about an increase in the intensities of those scenarios and the cases that you've been holding and dealing with as well as an increase in the complexities of those work. In Victoria, when we talk about LGBTQ+ family violence, I think we're on a shift in the definition slightly, because some of our work talks about the violence visited upon queer or gender diverse people, particularly by their families, not so much by partners. And so that complexity is a really interesting one when we think about some of the work that is being led by people in this room. And if I can put my government hat on, I don't know if I ever take it off these days, but when I put it on, we're very lucky to have a government with such a progressive and inclusive agenda to want to continue to do this work. And it's been a help to have so many clear recommendations that have arisen out of the Family Violence Royal Commission that named and recognised the need for support services, prevention, intervention and responses to be made available, particularly to lesbian and gay men, as well as our trans and gender diverse families. We've extended our definition of family violence in Victoria so that the campaigns and the work that happens around it names the violence inflicted upon LGBTQ+ people, and so that as I said previously, can come from within our own families. In a space where we're still trying to fight to get enough resources to deal with violence against women, we've had to make the fight to be an end conversation so that we're not set up for completing and competing for resources. The sector in recent years has had a more appetite and awareness of the work that needs to go beyond the binary system as well, and include many other genders, so non-binary and all gender family violence programs. And I think this sector right across the world is still learning and changing, and we're so lucky to be in a state where I think this sector is leading in parts of the world. So we'll be looking, I'm sure many will be looking to this report as a signal to where it is that we need to go. I think we also have a lot of catching up to do on acknowledging how much higher rates of domestic violence or family violence occur in relationships where at least one of the partners are bisexual. A lot of myths, I think, have to be undone around that work for the very services that are supposed to be there to support people in those particular situations. And one of the strengths of the sector's changes to understand the impacts on family and communities is our ability to understand this through the lens of intersectionality. We know that in Victoria, intersectionality is vital to the work that we do, and it's one of the core threads that run through our whole of government LGBTIQ+ strategy, Pride in Our Future. In the strategy, we've defined intersectionality as an approach to understanding how social meanings related to the way we categorise and identify can often overlap and interconnect. And I've spelt this out because there are a couple of things that I've discovered when I use this term. The first is that many people, including many who use this term, fail to really understand the kind of complexities of it. And the second is when I first insisted on embedding that term into the strategy and our work, I found a little bit of a pushback. And I've had people tell me that, particularly those within government or other leadership positions, tell me that people might struggle to understand the term and it might be too difficult of a concept for most people. I'm not saying that most of those people were white, but so I think there are many ways in which intersectionality allows us to understand that we don't fit neatly into a box, and for many of us, our intersectional identities add up to who we are, and intersectionality sometimes is how we respond to the way that we live our lives. And most of the systems we deal with, particularly when we try and categorise people by our presenting issues, it's not that often we get to tick the opportunity to tick multiple boxes, and it's even less often that services cater to all of our identities. A problem highlighted by intersectionality is that the systems that have been created for our support only work when they can chop us up into pieces of ourselves, and we know that as real people we don't divide easily. So I think the future of the LGBTIQ+ family violence sector, in order to remain relevant, must have an intersectional lens embedded into its core. But much like the air conditioning systems in government offices, a lot of that systems were built for white cisgender men in the 50s, and we know that that's not true for a lot of the domestic or family violence sector, but a lot is still being caught up in a cultural binary. And so I'd go so far as to say that if we're building our systems around the people who find themselves most marginalised, we'll end up building a system that works for everybody. In an attempt to want to push the boundaries or probably signal the next phase of where this research needs to go, I think we need to understand the other social and cultural factors that continue to shape the safety and identities of those who experience family violence in order for government to accurately respond and provide resources for particular areas of need. And I understand that there was a lot of work that has been done in the sector about the need to hold place for shame, particularly within perpetrator change programs. And I say we need to go a step further and go right into exploring how we heal from shame. I don't need to tell you that as a queer Wiradjuri man, I was the self-loathing product of a series of conversations that both colonisation and imperialism and religious thinking have set upon me, not just in me, but in my parents and my parents before me. And so I can totally relate to sometimes the rage that comes up for many people of colour around the times when we feel disenfranchised in our own countries about the work that is being happening or not happening within our particular communities. So we have to confront, I think, the toxic shame and the core belief that we're reprehensible from that, these beliefs that think we're critically flawed in order to heal and grow. But we also need to learn from the ideas of each other and apply this within our work. So I want to recognise that this sector has developed strong foundations, but sometimes strong foundations also mean something that's rigid and inflexible, a rigidity that doesn't allow us to innovate and respond to the needs of our communities. I'm not suggesting that this is what the sector is doing here in Victoria, but the kind of systems that are built around it. So I'm really excited and have been looking very deeply into this report about some of the findings, particularly the recommendations, and I want to applaud everybody involved for really pushing the boundaries here on this work and ensuring that we can create a system and can create frameworks which allow us to understand the complexities of family violence, particularly as it's impacted on LGBTQ+ people in the ways that we know it so much. So thank you to all involved, and it's a pleasure to speak with you today. I want to thank Carolyn Gillespie for the invitation and others in the room who continue to do the work as well. Thank you.
Thank you so much, Todd. You always have such incredible words to articulate the experience of our communities, and I really appreciate you being here today. Next, I'm going to hand over to Alicia Fuchs. Alicia is the Manager of Therapeutic Services, including our family violence programs here at Thorne Harbour Health. Alicia will facilitate a conversation for around 15 minutes with practitioners from both Thorne Harbour Health and Switchboard in relation to the research, their experiences and the learnings that we hope we can all learn from today. Thanks, Alicia.
Thanks, Carolyn. And thank you to all of the speakers who have gone before this panel. I think it really sets the scene for what we're about to hear now. It really locates the context to which with this report has been set. So as you can see, the panelists are arriving now. So my name is Alicia. I am the Manager of Therapeutic Services here at Thorne Harbour. My pronouns are she, her. I would like to also acknowledge the traditional custodians on all of the lands that we are gathering, across Australia. It was lovely to look in the chat and see many familiar friends, allies, people in solidarity with this work. We never do this work on our own. So with that, I acknowledge my panelists here. I'm going to invite people to introduce themselves. So let's start with that, shall we?
Hi, everyone. My name is Fahad, and I use he, they pronouns, and I'm a family violence practitioner at Thorne Harbour Health.
I'll go next. Hi, my name's Kate. I use she, her pronouns. I'm the senior practitioner in the family violence team here at Thorne Harbour Health.
Hi, my name's Libby Jamison. I'm the Q-Life and Training Manager at Switchboard. My pronouns are she and her. I was the Rainbow Door Manager for the first 2 years of the service being in operation, and so I'm here to speak to the setup of the service.
Thanks, folks. So really, this is a conversation for us about the skills and knowledges of the practitioners. Hearing Shane take us through the research again, the reflection opportunity that was, and I know we touched base the other day thinking about, what this research enabled us as practitioners to do. And I think, one thing that Eleri spoke about before was the assumptions that were challenged, that there wasn't any, that we had to move through all these ways in which the work we'd done previously. And so I suppose my first question is, as a practitioner, what was the experience like to do such a fast pace, in such a short space of time, transition of the work? Fahad, can I invite you to start us, because you shared a story with me around a particular client very early on that required multifaceted, all of the kind of tech that was, on the run. I'd love for you to speak a bit about your work.
Sure. So I think none of us got the time to really think about it. And as Shane said that, that was kind of the first time we kind of reflected, at least I reflected on how we have worked, or what has happened in the last 2 years. So very early on, when there was like one of the strictest lockdown, there was this client with multiple intersectionalities. They were refugee and they recently moved to Melbourne, and they didn't know much about, the city also. They have never visited the city, the CBD as well. So they requested services, and they were living in a family violence situation. So we used to have sessions when they go out on walks. So, in the park or, things like that. Safety planning was a very important part of that, where are you? Can someone listen to you or not? Sending SMSs or not, things like that. English wasn't their first language also, so that was kind of a barrier as well. But because I can speak multiple languages, so I was able to, communicate with them a little bit in their own language as well. And eventually, they requested that they want to leave the family violence situation. They want to leave the house. And so we arranged a taxi, for them during the strictest lockdown. The problem is they are not female identifying, so we couldn't find any emergency refuge, which is like a big factor which is missing, for LGBTIQ folks. So we had to book a hotel for them, and we had to get them moved there. So the taxi was waiting for them somewhere closer to their house. They left with just some clothes, and like me and my team, we were supporting them during that time also. We talked to the taxi driver. We provided them with a letter also, that if the police stops them, they can share that letter with them. And eventually we got them into a hotel safe. But then the next step was, getting them clothes or laptop or a phone or a SIM card, and maintaining safety as well. So again, that was because everything was closed. So that was a hurdle as well. And we had to literally find new ways of, navigating all of this. And I couldn't have done it on my own. So I literally have to ask my entire team to come together and, with the ideas. And eventually, now that person is safe, we help them find a job as well. But I think that case taught all of us that, this is how you have to navigate in this scenario, in this pandemic. And it kind of set the tone for the future also. And kind of, whenever there was an issue, we could look back to it and be like, okay, this is what we can do. But I think, again, looking back at it, the main thing was there were no supportive services for us, like in the mainstream service. So that made our life and work way more difficult than a mainstream service. And being an LGBTIQ specialist service, we have to provide all sorts of services to our client, because we can't really make a referral to a mainstream service or any other service. So I think it puts a lot of pressure on us. Apart from the pandemic, there are all these pressures.
It has me thinking, which the report really acknowledges, is the history of both Switchboard and Thorne Harbour Health in responding to, community demands, community needs, and what might be some of those skills and knowledge. Libby, would you be happy to sort of speak to how you saw LGBTIQ organisations really, in some ways, being at the forefront of this pivot? Many of us know of other organisations that, there was incredible delays to even trialling technology. And, what we really heard from Switchboard and from Thorne Harbour was that was a very rapid transition, that it was, yes, the whole state was doing transition, but it was done very differently. Do you think there's ways in which the community-based kind of organising activism of our work influenced that?
Look, 100%, listening to people talking in the webinar today, I keep thinking about the passion and the concern of staff who came on board to work at Rainbow Door, how we personally felt worried about the work, and that everyone, went the extra mile. And I really want to acknowledge those staff for the work that they did. When we set up the Rainbow Door, we set it up as a 7-day-a-week service to be really to offer multiple ways or multiple options for people to access the service. Also, text was really important when we set the service up, that we knew that text is a really important way for many people in community to want to access service, and at least initially. And, this is, at the core of our work at Switchboard. being connected to community, being grassroots, and intimately understanding what those lockdowns meant for people and anticipating the issues that people would have and the barriers, as Fahad so eloquently talked about. You know, one of our concerns was setting up this place for people to come and access service, but then the worry about not being able to refer them out to safe and culturally appropriate services that would pick them up. And the partnership between Switchboard and Thorne Harbour was amazing in the way that we worked together. And I guess it was different for us because we were setting up a helpline or as a callback service as it was. We didn't have to worry about too much about the pivot from face-to-face work to using technology. We dived into technology and made it work for us. And I think for us, it was the unknown of not knowing what the demand was going to be like. And really, we kind of just had to roll with it. And I don't think I'm answering your question, Lish.
That's okay. I mean, when you were speaking, I was thinking, you know, the stuff around partnership, and maybe Kate, you want to talk to, you know, they increase the demand for service, you know, both Eleri and Shane have, you know, acknowledged that there was an incredible demand for family violence services. Could you speak, Kate, to some of the holding that happened during, you know, the last couple of years that perhaps was different, or, you know, and how are those things influencing our practice now?
Yeah, we saw a huge kind of increase in demand and still increasing demand. I think the pivot to things like Zoom have been brilliant in that we've been able to become a really much more of a statewide service. I think previously it was very like metro based. We were expecting clients to come into the offices, whereas now, of course, we can. We've had clients in, you know, Bendigo, Gippsland, like all over the state. So we've seen a huge sort of, I guess, increase in the accessibility of the service, which has also led to an increase in demand. In terms of holding, it was tricky. I think it felt at times holding clients, like when we were at home on our own, felt challenging at times. I think we do a lot of incidental support in the office that is trickier to manage at home on our own. You know, even just you could overhear a colleague having a difficult conversation and approach them afterwards and kind of have a bit of a debrief. At home, you can't really do that. You have to try and reach out. We did set up some good incidental support things via like Zoom and our WhatsApp chat that we still use a lot to kind of facilitate that, I guess, like team culture and not feeling so isolated. But there was a sense of, increasing holding of risk at home and, increasing demand for services.
Mm. And Fahad, as we, continue in this work, with high demand for service, as a practitioner who is working with, victim survivors, every day, what are some of the learnings or, reflections you have on the work now, that have been as a result of all these transitions and changes? What do you hear from clients now in terms of how these hybrid models that are embedded, what do they mean for clients?
I think mainly what I hear is really positive feedback around that, the accessibility is easier. So the client engagement has increased as well. So there are less no-shows now, Rarely clients want face-to-face sessions. I think with victim survivor work also, if they are living in a safe home, that is their safe haven, so they don't want to leave that, come to a new space, and so the sense of safety for them is extremely important. And like as we were talking about, that clients from regional areas, clients who have disabilities, clients who have multiple intersectionalities, for example, refugees or asylum seeking clients who don't have resources, so paying on public transport also cost a lot of money, but this saves a lot of their time. A lot of young people, they don't want to come to, offices, So I think mainly it's very positive. The main problem occurs only when they are living with the user of violence or with the perpetrator. Then, we prefer that they can come to office or do other sorts of safety planning, as we've talked about. But yeah, it has kind of revolutionized it. And to be honest, as a worker, I also feel, get less stressed a lot of times because especially because of the cutting of the travel times. Yeah.
Are there other reflections, Libby or Kate, in terms of, were there things that surprised you, in the conversations about the research that you reflected on? Were there ways that, having the opportunity to sit down and really think about the work with clients over the last couple of years, were there things that, surprised you?
I think it was really valuable for the people from Rainbow Door who participated in the research, as Shane said, to actually sit back and take a breath and think about what we did. We were so head down dealing with the demand that that opportunity to reflect and actually look at the success of setting up the program in a really short amount of time. Sure, it's not perfect. And there are things that still need to be worked on, and it will be great for us to have more time in real space together in an office at some point in the future. But to actually just celebrate the achievement and to be able to hear from people who access the service about what it had meant for them to have a conversation, to be referred to a safer service, and to really reflect on what an incredible thing we did.
Thank you all for bringing your contributions to the webinar today and for your work. I am going to close our panel now and invite Carolyn back for some closing remarks. So thank you all.
Thank you.
Thank you, everyone. And this brings us to the conclusion of the launch. To close, I want to express my appreciation to all of the speakers and panelists for their contributions and their commitment to the work today. It was really profound sitting and listening and picking up what Libby said, really just acknowledging what an extraordinary job was held by so many people through such a challenging time. I also want to finalise today by really centering and acknowledging the voice and lived experience of victim survivors and the shared commitment that we all have to working towards a world and community free from violence. So thank you again to Family Safety Victoria for both funding and launching this LGBTIQ+ community-led research project. And thank you to all who've attended today and for your own work and advocacy that you have in this space. I wish you all a lovely day.